Good evening, everybody. My name is Jeff Ashby. It is just my pleasure to be here with you this evening. It is already the 7th of February, and you know that the first Wednesday of every month we are here in this capacity, just having an incredible opportunity to visit with Dr. Prasad, the world's foremost expert on micronutrition and supplementation. In fact, I'm going to just before we pull Dr. Prasad up and start this evening, uh, I want to make sure that we are all protected from a legal standpoint and understand that Dr. Prasad is here in the capacity of uh, a PhD, a doctorate in radiation biology. And I'm gonna just pull this science booklet up and introduce you to Dr. Prasad, the man behind Micro Daily. And it states right there under accolades, highlighted in yellow, world's first radiation biology PhD, University of Iowa, Iowa City, back in 1963. It's exciting to have him here with us this evening. But before we go on and share anything else, once again, we need to protect ourselves. And so I'm going to pull the disclaimer up onto the screen here with me. Please follow along with me as I read. These statements and comments have not been evaluated by the Food and Drug Administration. This information is solely for educational purposes only and includes recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. However, Engage's products are formulated to address nutritional deficiencies and supply the body with the required nutrients. It is important to note that nothing here is meant to be a substitute for professional medical treatment or a consultation with your primary healthcare provider. And so, Dr. Rich, if you could go ahead and allow those people in from the waiting room, if you wanted to click on the admit all button under the participants list, that would
Okay.
be helpful.
Okay.
And you see how you're doing that? So I take my participants list,
Yeah.
it pops up onto the screen, and I move it over to the side so that I can see everything that's going on. And then I also have access to the participants. Perfect. Wonderful. Thank you for being here. Dr. Rich and Linda are out of the great state of North Carolina. We just met them here at the end of last year, and boy, in just a few short months, they have added well over 100 different individuals to these products, and so grateful to have their assistance in our Ask Dr. Prasad evening here tonight. But with that, I am going to pull Dr. Prasad up here into the spotlight with me. And as I mentioned, Dr. Prasad is just here in the capacity of a PhD. He's not going to be talking and doling out information about medical conditions. This is important that we are here to ask. And the best way that we can do that is to just go down to the bottom of your screen, and you'll see along there, there's a button called reactions. And under reactions, there is a reaction that allows you to raise your hand, and it'll actually say raise hand. There is a clapping, there's thumbs up, and there's a heart, and there's some reactions to comments. But if you could just raise your hand, then I can call on you. We're also monitoring the chat, and between myself and Dr. Rich and Linda, that we will be polling questions out of the chat this evening for Dr. Prasad. But that having been stated, let me just get my chat window up here. Ed says, give me a little more volume. And so I just did that. Thank you for the suggestion. I had my laptop down earlier with some meetings that I was doing. And so is that a little better on the volume?
Yeah.
Hopefully. Okay, awesome. All righty.
Much better. Thank you.
Awesome. You betcha. Thank you for being here with us, Dr. Prasad. We're going to keep this right to an hour. Uh, I tell you, I wish we'd have had another hour with you last night after our meeting there with Jonette and Dr. Court, and then those two incredible brothers that have collectively organized and put together the Brain Restoration Clinic. Oh my goodness! What a great conversation that was. The questions were amazing. You having prepared that entire protocol document. It today it's just been sending that out to just as many people because everybody wanted a copy of it. Thank you for making the suggestion that you did last night. That it is a work in progress. This isn't the final theme. As new research becomes available, you certainly are going to include that. And you know, who would have thought back when we were all in Cancun and we released that product called Digestive Boost?
Yes.
Who, who knew that we would be having such incredible, incredible responses in people's bodies?
Yeah.
My,
Yeah. That's amazing, especially in the autism spectrum. That's really the key of benefit to maintain the gut health and
yes.
all the metabolism and absorption, everything. Is
Oh,
I never thought that the digestive enzyme would be for that particular disease is absolutely essential, as much as
yeah.
probiotics.
Yeah, and that was amazing. That research that you did talking about the mice or the rats that
Yes.
became antisocial just
Yeah.
because they're missing a hormone,
Yeah.
and that and
Not
there is no way for somebody who has autism to break down the protein that results in that hormone.
yeah.
Wow. So awesome. Well, I see that we have two hands that are up already. We're going to
Okay.
start out this evening with Pam Brown. Pam has her video on. She just needs to open up her microphone or unmute herself. And then our very first question for you tonight is from Pam Brown. So here is Miss Pam. Go ahead. Your question this evening for Dr. Prasad.
I think I remember Dr. Prasad saying that if we were taking the microdata, we didn't have to take extra potassium and calcium. Is that right?
That's correct, because if you take a good diet, you don't need to take a potassium. But calcium is different issue. Calcium for the people who are 45 or older, especially in women, not in men, in women, it is important to have a calcium supplement to prevent osteoporosis when you grow older. And so, but we don't have a calcium supplement in our, but we always recommend calcium supplement. But when you take a calcium, you also take half of them as a magnesium. And what we do, my wife takes is a calcium citrate because it is absorbed better, 1,000 milligram, and 500 milligram is the magnesium citrate, and you can buy in any store. But the ratio is very important, and form of calcium is very important for better absorption. And potassium, if you take a half a banana every day, that will be more than enough potassium for you.
Okay, thank you.
You bet. Very, very good question. Thank you, Pam. And thanks for leading off our evening. And already, you guys, I have commented on it in the chat, but Miss Linda Bailey has posted Dr. Prasad's protocol for autism, and it is just right there in the chat. So go in and click on that, and it'll allow you to download a document. It's a Word document, and that's what we were discussing last evening. Such an incredible meeting. Dr. Prasad, we had 171 people on there,
Yeah.
or
I mean, if
170.
there is interest, we can repeat that segment if people are interested in at some future time, because that is a major issue. A developmental disorder like autism spectrum, ADHD, you know, and many anxiety, depressions, these are linked with many other diseases. And so we can do it again if we wish, if people wants to
Oh,
do.
I really think that we will. And I was hoping that we could do a follow-up, maybe
Yeah.
even next Tuesday, but I don't know. I don't know if that's I'm not I'm not in control. I'm not in charge. You so we will make sure that that gets together. All right. So Ed Howard is the next, and then we have Cheryl Johnson and Denzel and then Miss Roberta Rice. So that order is where we're going to be. So Ed, oh, look at you. You've got your
Okay.
camera
In a
and,
mountain.
Yeah, hi everybody. Hi, Dr.
Hi, Ed.
Prasad. Hey, nice to see you.
Sure.
Yeah, I was wondering about. I was listening to last night about the autism. That was very, very good. I had a question on Alzheimer's because it seems like some of the people we know have issues with being able to get on the product and not have. So what order of priority? I would assume it would be the probiotic and the micro daily EMF first, and then
Yes, I think those
wonder
two.
what you would suggest and how long to go on one or the other before you try the other things.
Actually, for example, in case of, I would say that at least we have a micro daily, say, for example, EMF, either hydro or capsule, and then probiotic. This is a must. Third most important would be collagen peptides. Why? Because it has been demonstrated that by PET scanning, in Alzheimer patient, the brain shrinks. The question is why brain shrinks certain area? Well, because the loss of collagen. One of the major function of collagen is to maintain the structure integrity of all organs, brain and skin. You can see it when you are losing it, but when you are losing in a brain or heart or kidney, you don't see it. You don't observe it. So people did a clinical study and gave a supplement to collagen peptide of some kind, and it was a 12-week study, and they found that the structure of the brain improved, and also cognitive function also improved markedly. And therefore, third most important would be the collagen peptides. And
Yes,
and fourth, I'm going to sequence whatever you can afford it. What is most important is, and fourth would be omega-3, because, for example, it has a DHA and EPA. 40% of the brain fatty acid are DHA. That tells you how important it is in formation of membrane and receptors and so on. So those fourth are in a sequence. I said it, and sometimes at least the advanced stage of the disease, patient becomes very irritable and aggressive, abnormal behavior, and for that again, then the CBDs become extremely important, at least 100 to 200 milligram per day. So it depends upon the stage of the disease, but if you have the earlier stage, I think micronutrient and I would say the probiotics and the collagen peptide, these three must. And I know omega-3, I kept it fourth, because sometimes you eat through the diet, you have something there. It is not completely devoid of omega-3 daily from the diet.
Ed?
Is that answer your
yes,
question?
there was the question on the CBD was 200
I said that
milligrams.
100 to 200 milligram. Yeah, if the behavior is that bad, I start with 100 milligram.
Okay. Yeah. And then how does the digestive boost fit in there?
Yeah,
I would
digestive,
imagine.
again, digestive is important, especially older people who produce less one, so that would be my fifth ranked. The digestive enzyme is very important, especially older people. And but it is from absorption point of view, overall absorption, not just the protein absorption. Like in case of autism, it is just a specifically protein absorption, not fat, not carbohydrate. And so, but in the case of older people, like Alzheimer people, absorption is all. Carbohydrate is not properly absorbed, protein, not fat. So I would say that that would be another one that I would consider. But again, sometimes depends upon your financial situations and if you can afford it, But that is the sequence I would do it for myself.
Wow. Thank you, Dr. Prasad. Very, very good information, and interesting that you swapped the collagen and the omega-3 when it comes to somebody.
Yeah, but because there has been clinical study that brain shrinks. And when brain shrinks, that all kind of mental problem you have. And so it is important to maintain the structure, improve the structure of the brain. And that's why collagen peptide becomes so important for that particular disease.
Powerful, powerful. Well, thank you. It looks like that we lost Ed without saying we appreciate his question, but very well thought out, and thank you for the answer. We're going to go to Cheryl Johnson, and then Denzel, and then I'm going to go to the chat. We'll take a couple of questions out of the chat. So, Cheryl, you're up. Thank you for opening your camera. I love this so that we see everybody.
Okay.
Go ahead. Your question for Dr. Prasad this evening.
Hi, Dr. Prasad. Hi, Jeff.
Hi.
The question that I have is what reason would the doctor say on the microdaily EMF that there are too much of the fat soluble vitamins in there?
That's incorrect because fat soluble vitamin we have is a vitamin A, which is 3,000. That's the minimum requirement. It is, and a vitamin E succinate is very important. It is higher dose, that is a fat soluble, but we have two forms. Half of them are water soluble, half of them are fat soluble. Vitamin E succinate is very readily soluble in a water, and vitamin E acetate is in a fat. So that statement is not correct. Because sometimes doctors say vitamin E, they don't know the difference between vitamin E succinate and vitamin E acetate. And that's the only two things that you have fat soluble. So, if you take a fat soluble like vitamin A 10,000 international unit and over, that it can cause toxicity. But we are careful on those issues. And so that's incorrect. And if the doctor has a question on the issue, I will be glad to answer them.
Okay. Now, is there vitamin D in the microdaily?
Yes, vitamin D3 is there. Vitamin D is absolutely essential for health, variety of reasons, not only for bone and other things, but your overall health. It also acts as anti-cancer agent in prevention. So vitamin D3 is very important. There are vitamin D2 and so on, but vitamin D3 we added it, and it is the vitamin D your body makes when you go in the sun. Even younger people nowadays have vitamin D3 deficiency because they don't go in the sun too much, most of them. And they work in an office, go home, have a dinner. And so a good example would be my own son. And he's young and still he has vitamin D deficiency. And so many people, so the doctor these days test routinely, make sure you are not vitamin D3 deficiency. And we have sufficient, so we have, even though we have, I think it is a 800 international unit, but people take up to doctor recommend of taking up to 5,000 international unit so that you maintain a good level of vitamin D3.
Hmm.
In old days was vitamin D3, old study was vitamin D3 is not good for you, too much. But right now people are taking it. And for example, in old days, they have measured it. The people who used to work in a cotton field all day in the summertime in South and black populations, and their blood level of vitamin D was equivalent to 10,000 international unit, but they were safe. So I don't think it is that an issue. Micro daily that we have, safety is not an issue.
Okay.
Awesome.
Okay.
Electricity.
Thank you.
Thank you,
Preventive dose
Cheryl.
that we recommend daily recommend.
Thank you, Cheryl.
Thank you,
Great
Doc.
questions, and everybody's going to benefit from the answer that that Dr. Prasad gave to you. So thank you, Cheryl. All righty. So Denzel, and then we are going to go to the chat and pull some questions out of there. Go ahead, Denzel.
Hi, thanks, Jeff. Hi, Dr. Prasad. Sorry, my camera's not on. I'm
That's okay.
almost in bed, getting ready for an early appointment in the morning. My
That's okay.
question is on macular hole.
Mm,
Macular hole is a tiny opening in the retina towards the back of the eye.
mm.
Happens to a small amount of people as you get older. And
Yeah,
I've started on the,
generation. Yeah.
but this one is a macular hole, slightly different.
Okay.
But I know in terms of the eye health product, you have the eye boost.
Mm.
Anything else to add to that to
No,
strengthen?
I think I think I would say that instead of one capsule, you can increase to 2 capsules a day. Because again, all the antioxidant we have there is totally non-toxic. So in her acute case, looks like that, I would only suggestion I will make that you increase this twice and have a micro daily EMF hydroform that would be absorbed quickly and distributed rapidly. And after that, other things are probiotics is a must. And core 4 what I'm talking about.
Yeah. Okay. That's all right. Good. I'm on the right track. Thank you very much. That was it. Appreciate it.
Thank you, Denzel, and
right.
welcome to the family. Knowing that just recently became acquainted with the Engage products, and we've Denzel and I've had a couple of conversations. So I'm glad he was on here tonight to ask questions. Thanks
All
again.
right. Thank you.
All right. You bet. So Dr. Prasad, I'm going to go to the chat, and we've got a couple of things posted over here. The first one was actually posted last evening, but we were talking all about the autism, and so I says come back tonight, and so let me just read this. It's in regards to a chronic lymphedema. And I know we've talked about this before. It says veins have collapsed in the left leg, arthritis in the knee. I've had some issues with my kidney when the doctor put me on high blood pressure medications, which I stopped taking any kind of medications. What would you recommend? The Dr. Prasad Core 4 bundle or any other recommendation? So chronic lymphedema, looks like high blood pressure and some kidney issues.
Yeah, I mean, the kidney issue, as you know, she must have a high oxidative stress and inflammation. Only thing I would recommend because of this problem of the blood flow, what do you call one agent that let me see. 1 minute, please.
Okay. Oh, this is great. Thank you. This is how much Dr. Prasad cares about these answers, and to have him just collect a reference and make sure that he is sharing with us the right information is just representation of who he is and how much he cares. So, and thank you, those of you that are answering each other questions.
Yes, I think what I was thinking about was I just citrulline. Citrulline is extremely important for vasodilation because it looks like, sometimes in any kind of a chronic diseases, like she has arthritis or vein problem. I think only thing that I would recommend outside is the citrulline. And citrulline, we don't have it right now. And but also you can buy in any store, anywhere from, it's not very non-toxic. You can have from 200 to 500 milligram a day. And let's see how it improves your, and sometimes blood pressure is also because of the poor blood flow. It creates a pressure. And so I don't know. But, those are complex disease. I think it is a good that you should take also doctor's advice on this issue. But I'm simply saying how it can be reduce oxidative stress and inflammation in your body and increase the blood flow. That's the only thing I can say. But consequences, you try for a month and see if it helps. And then let us know if it has been helpful.
Yeah. And so we had somebody said that could you spell citrulline? I know citrulline is derived.
Citrulline. Citrulline.
Citrulline. And
Citru, citrulline, Lline, citrulline, L-citrulline. And this is found in the watermelon is very rich in citrulline. They isolated from the watermelon.
That is great. Okay, so we've got somebody here that last month asked about varicose veins.
Yeah.
And you were going to do a little research, didn't know if you'd had a chance.
I did not do it. Sorry. Okay. Varicose vein.
Yeah, I had forgotten about that as well until it was
I will
posted.
I wrote down, then I will look at tomorrow.
Okay, thank you. Thank you so much, Dr. Prasad. One other one that I'm going to take from the chat before we go to, and I think Roberta Rice had several of these questions in the chat, and so we're taking care of those. So we may just go to Elizabeth right after this, but Rebecca Jacobson asked about the different, here, I'm going to, sorry, Roberta, your microphone is open. I'm going to just mute you for a moment. Rebecca asked about as she says, I know a doctor who uses Omegagenics by Metagenics, which has a DHA 580 and an EPA 680, whereas Engage Global's Omega Boost has a DHA 500 and EPA 250, which I'm sure you have a scientific reason for this ratio. What could I tell him? Do you want to go into a little
scientific
bit?
research, there has been a clinical study on this one to improve brain function, and we found out that the ratio of 2:1 is very important, and it is a DHA which is most important component is there, and so that's why we have given 500, and but also we have a alpha ALA, which eventually slowly get converted to DHA, but it's very slow process that you get from the vegetarian diet. And so our I think, is a very unique, and many people have added without any rationale. There is no rationale why you have a high level of EPA that he added and a lower level of DHA. And so you just add something there. But my goal is always that is based on scientific evidence.
Yeah. Well, David came on when we released the Omega earlier on last year, and he talked about that the way that you have the ratio, we're putting more of the more expensive
right
in,
exactly.
and so
and also it has been approved by patent, as you know. We have submitted this.
yeah, we're not telling everybody that just yet, but
sorry,
yes, you're right.
No, but I mean, I think people can make all kind of variations, and but I think we think that we are based on scientific evidence, and that's why whatever we have developed as the best outcome, health outcome.
It is, and we've had numerous individuals come forward and say they had been on competitive omega-3 products, and this one, they feel so much better. They're really feeling like that their value has increased a lot. So awesome. All righty. So I know Roberta Rice, I lowered your hand, but I think we took care of your questions. But before we go on to Elizabeth Henry, did we cover everything? I don't want to.
Brother Jeff, thank you and Dr. Prasad so much. That's a relative of mine that's it's really been suffering through a lot, had horrible side effects from medication, like I did at one point uh, with autoimmune disease. Just as I had made a quality decision to go holistic products only, is where I am today. Thank you so much, Dr. Prasad and Brother Jeff. Now, my family member, I posted, she's getting her medical records from the doctor's office, so we know exactly everything that we're dealing with. But she expressed to me she could not do the drugs. I understand, been there, done that, and she didn't even know what I had been through. So she's going holistic. I did order her the Core 4 Dr. Prasad bundle. She got it day before yesterday. I got her testimonies. This
Awesome.
morning she was just jumping and screaming and hollering, so to speak, that she was up moving around. She had even started to clean her house, which she had not done for a long, long time because of being in pain and inflamed leg and knee. She is so excited, and this is her second day of taking a product. She had a similar experience like I had. Mine was within 24 hours, hers in 2 days. And plus, of course, I have her to change her diet. She's doing fruit and vegetable, no sugar, no salt, drinking plenty of
That's
clean
good.
water.
That's
Um,
good.
she's very excited about these products. So what we wanted to know is there anything else she should be doing? And Dr. Prasad, what do you know about, someone asked me today about a compression machine,
Compression machine.
a compression machine. You know how you can wear compression socks? I was told there's a compression machine for lymphedema. I don't know if I'm saying that right.
I'm not familiar with that.
Okay.
I've s- I've seen some in a hospital situation where they'll pull on it and it pumps air through and it kind of it stimulates the leg to keep blood circulation going. But I think
Okay.
I think you need to approach it just like you are here with a proper nutrition. And
Okay.
the only other thing that and we talked about it earlier. Many people are benefiting from the digestive enzymes.
Yeah.
And
Okay.
Dr.
Yeah.
Prasad
Yeah.
talks about
Yeah.
the core 4+1.
Yes. Yes.
Digestive enzymes. Okay,
They
we'll
call
get right on
digestive
it.
boost.
Digestive Boost is the name of it. Yep.
Okay.
Yeah.
We'll get
Okay.
right on that one. Thank you all so very much.
Fantastic.
Yeah.
Already. Appreciate it, Roberta. All right, Elizabeth Henry, you've been waiting so patiently there, and it is your turn to pull you up here on the spotlight and ask your question from Dr. Prasad. Go ahead.
I may have missed this, but what is the protocol for a person who has dementia?
Dementia, the core 4 is the important one, and the plus digestive enzyme. And if it is an advanced stage, like your abnormal behavior, for example, then I would suggest that take 100 milligram of a CBD. But if there is no abnormal behavior problem, then you don't have to take it. Until you have sleeping problem or anxiety or anything like that, then that's very important to have people who have anxiety, depressions, and agitations, and this kind of behavior problem. Then that's the only time that I recommend the CBD.
I was told that the person has very much difficulty walking during the day
Mm-hmm.
and a lot of pain, can barely walk, but in the evenings will walk all over the place.
Okay.
So we don't understand why he's almost immobile during the day.
I think during the day, I mean, sometimes, you can force it, because sometimes, you don't feel like, I can't explain why it happens in that daytime. He doesn't want to talk. I think he should force himself. Like many times I force myself to go for a walk. And so, even say 20, 25 or 50 steps, sometimes your body used to certain pattern, and they don't want to change it. So it is our job to force it to force to change it.
Thank you very much.
Sure.
Great question, Elizabeth, and thank you for your
Yeah,
patience.
thank you. Yeah.
Okay, so we're going to go to Alfreda and then Rita Cheney, and then I've got a couple other questions from the chat, and we're about going to be done here tonight, Dr. Prasad.
Okay.
Alfreda, you are up. Can you turn your camera
Alfreda,
on?
old friend.
Out of Ohio, yes. Alfreda, you're up next. You'll need to unmute yourself. Alfreda, did we come to you and you're not quite ready for us? All right, so we'll leave her hand up, and she'll probably come back
No,
here.
here I am.
There you go. There you go. Okay.
Yeah, I was trying it's always a slow time with the video. Hi, Dr. Prasad. It's
Hi.
nice to
Hi.
see you again. I'll try to get my video up. I have a friend that she wanted me to ask a question because she has breast cancer, very severe breast cancer. If you could talk about how Microdaily helps to destroy cancer. And then we want to also add, if you could also talk about how the probiotics help a person with cancer. But the question was, does Microdaily affect cancer cell or work by boosting the body's immune system so it can fight the disease?
No, she has active cancer, right?
It's a triple negative breast cancer.
Yeah, triple negative.
Very serious, yeah.
Yeah. No, what we suggested, only thing we suggest, don't take collagen peptides. That's to start with.
Right.
No collagen.
Not doing that. She is doing she's doing the therapeutic dose of Microdaily, so she's taking the hydro three times, 3 sticks 3 times a day, and then she takes the CBD pain, and so we have those two
Yeah,
things.
and also that the probiotics, I presume she takes probiotics.
Not yet. I wanted you to
That is a
comment
must.
on how that will
No,
add to that
probiotics is
protocol.
extremely important for cancer patients. Is extremely, otherwise the effectiveness of many medication, like say for example chemotherapy, would be markedly reduced if you don't have a intestine working. If you have intestinal dysbiosis, in other words, if you don't take the probiotics, then it would be even effectiveness of the vitamin can be reduced. So I think
I
both
didn't know that.
digestive enzyme and this one is a must. Only thing we said, and if you can't afford it, then for example, the omega-3, you don't have to take it if you have a cancer patient, but you must take, like she's taking therapeutic dose of micronutrient, DMF, and also probiotics, digestive boost, and on collagen if she's anxiety and so on. And then this is very important. And then whatever doctor suggests like chemotherapy or radiation therapy, then she should take it. Because what happens, at least there is experimental data, that when you combine the doses that you are taking, antioxidant high dose or therapeutic dose, in combination with chemotherapy or radiation therapy, they will further enhance their effectiveness on cancer cell, but not on normal cell. If anything, they will protect the normal cell. So there is no hazard of, but what I wanted to
But
warn,
she doesn't want to do chemo or radiation
yeah,
at this point, and
but
she's been fighting it for over a year.
I would say that, for example, if you, I don't know how long you have been taking this micro daily.
A week.
Oh, that's too small time. But
Yeah.
see what happens after a couple of months, and then you can decide. Suppose if it is still some left, I think I would advise her strongly that she can combine with radiation therapy or chemotherapy or whatever the doctor suggests, because you will not have a toxicity. See,
Right.
the region,
It'll protect your
if you
cells.
take a protected, we will protect it. And at the same time, it will protect normal cell, but not the cancer cell. That's the beauty of this high dose antioxidant. So anything comes, chemotherapy or radiation therapy, she should do it, but of course, up to individual whether she wants
Could
to do
you,
it.
one more thing, please comment about the patent that you
I have submitted the patent and it
acquired?
has been approved, but we have not got the number of yet. And lawyer says that by the end of February, I should have the number. But
We'll say what the patent is.
so
So,
patent is the high dose antioxidant, kills cancer cell, but not normal cell.
yeah,
And in combination with radiation therapy and chemotherapy, it will enhance their effectiveness. That's the
yeah,
main thing of the patent is.
yeah.
But my goal is there to have some investor and eventually get FDA approval.
Oh, yeah, you're gonna get it.
Yeah, I mean, because there's
Powerful.
really data that we are collecting,
Yeah.
anecdotal story type, and that I have no doubt. And there is a lot of experimental data, which I initiated it long time ago, that they support the idea. But see, the
Yes.
oncologists fear when they heard word antioxidant, they don't know the difference between the action of high dose, therapeutic dose, and preventive dose.
Mhm.
Preventive dose protects against free radicals. Like if you have getting a chemotherapy or radiation therapy, most of that damage is produced by free radicals. So if you take a preventive dose, it will protect it. So that's a counterproductive. But high dose antioxidant work totally different. They
Yes.
block the uptake of glucose and glutamine that cancer cell must have to survive. And if they don't have it, they will die, no matter what kind of cancer you have.
That's fantastic. We're really looking forward to that happening. He's had some good results even this week. So
So let us know, keep us informed. And
yes.
that is after a couple of months, tell Jeff, and to Jeff, I all communicate with Jeff all the time. And he will
Mhm.
tell us how it is doing it and see what can. But I would suggest that after a couple of months, if the tumor is regressing, that this is okay to wait. But if tumor stop regressing, then should immediately consult a doctor and get chemo and radiation and continue this therapeutic dose that you are doing.
Yeah, it's
Sure.
very, very aggressive. It's
Yeah,
actually,
triple negative is very aggressive
yeah,
because you
coming
keep
out of
using
her
the
body.
anti-hormone, and so it's one of those things that there are three different types of triple negative. Then there's some positive, some negative, hormone negative, estrogen negative, estrogen positive, progesterone negative, progesterone positive, all kind of breast cancer we have. But high dose antioxidant doesn't care about what kind. As long as it's cancer cell, you will need a glucose, you will need a glutamine survive. And if you can block you by any way, then you are done. You die.
Have you ever, one of the things that I did some research on, um, have you ever read any studies about, putting baking soda because on the cancer? I read in PubMed this week, and because the cancer is outside of her body, sort of like the lesion that Beth's customer had, but it's protruding out. So we were using, she was putting baking soda, and that seemed to calm it down some. Um, and the study in PubMed said that baking soda can help destroy cancer cells, but you got to do the internal also was very important.
No,
They actually had a
I'm
guy
not
on.
aware of. I would not
Well, I can
recommend.
send it to you
Yeah,
because they
sure.
actually had a guy that
Sometimes people
did
claim, I tell you
vitamin
another.
supplements and that.
No, some people claim it, but there is no published information that has been peer reviewed. You can publish anything in a PubMed. I think I remember that one time when I was visiting Oslo for cancer conference, and I met a woman, a physician woman from England, and she said the way she treats it, he put the body in alkaline situation, not acidic, alkaline, and
Hmm.
she claims result, but She has not published it. It is personal experience. I have no idea. I can't comment it. I didn't say,
Okay.
you see what I mean? And
Mhm.
because in PubMed, you can publish anything as an individual opinion, okay? Whether it's a doctor or not doctor, you can publish it. But until the publication has gone through peer-reviewed journal, where people have
Mhm.
examined critically,
Mhm.
as you know, most of my publication has been a peer-reviewed journal, and
Right.
it is not just my opinion.
Well, that's good to know.
Yeah,
That is awesome. Thank you,
Thank you.
Alfreda. We've got another just great questions. We like to take a few more than just the one, but that was amazing because we all benefited from Dr. Prasad's response. And I need to just pause here and say, as we are talking about particular conditions in the body, as like cancer, that we're not here to diagnose, treat, cure, heal, or prevent any disease or injury.
yeah.
We're just talking about nutritionally supporting the body. And Dr.
And always
Prasad,
consult your oncologist. I always suggest you consult your oncologist. And if
yep,
he and she has any question about that, I will be glad to answer them. But based on experiment that we have, this is possible suggestions. And it will not interfere with the chemotherapy or radiation therapy. There is no data to support that it will interfere. But if you take a preventive dose, it will interfere.
yeah. So you need to triple that dose,
Yes,
minimum,
yes,
tripling
minimum,
that
yeah.
dose. That's the
And again, this
high.
is short time.
Oh,
I mean, a month, 2 months, after that, if you are combined with radiation therapy, chemotherapy, tumor will be gone.
yeah, yep. All righty. So Rita Cheney is up next, and then I'm going to take a couple of questions from the chat, and we may get to Rob and Ursula, but let's just look at our time frame. So Rita, you're next. You've been patiently waiting. Go ahead.
Good evening, Jeff and Dr. Prasad.
Sure.
I'm taking all of the products. I have glaucoma and some other eye issue. So I started taking the eye boost, 2 capsules twice a day. So that's 4 capsules. So I'm just wondering if I should continue that, or is it okay? Because I know that omega-3 has some ingredients in there for the eye also.
No, I think eye boost is a must because it has some unique astaxanthin that accumulates in your retina, and retina is very oxygenated, and anytime excess amount of oxygen is present, they produce a lot of free radicals. And lutein and zeaxanthin that generally we have in the preparation, they don't accumulate enough, sufficient amount to take care of that. So I think taking the eye boost together with core 4 is very important. And also don't forget digestive boost.
Yes. So I should continue taking
Yes.
the 4
Yes.
capsules a day?
Yes.
Okay.
That's what I do, Rita. I mean,
I do.
just
Same thing I do too, twice.
yeah. Yep.
Okay.
Doubling up on
at my age, my eyes are very good. I mean,
well,
89 plus.
Yeah, all of us, our eyes have been the same for years and years and years, centuries. I mean, go back, the eye has not changed, but look at what we're subjecting the eyes to. I mean, I'm looking here at my laptop, and I've got some bright spotlights on, and then we've got our cell phones, and how early are we being exposed to conditions that our eyes just were not designed to look at these screens, and so
for a long time. Yeah, that's why as you get older, you develop all kind of eye disease if you don't intervene earlier.
Okay. All right. Thank you.
Thank you.
Very, very good questions. Thank you. Let's lower her hand. All right. So Dr. Prasad, about 7 minutes left here. I'm going to go to the chat, and this is one, Anthony posted this. What is the best autoimmune, what if best autoimmune induced disease is caused by an antigen, antidote, or nucleotide being presented by CD16 non-classical monocytes? So it's basically, the question is about an autoimmune disease.
Yeah, I mean, again, as I mentioned that We don't have a human data on this one, but from nutrition point of view, I would say that at least the worst thing would be it has no impact. And the best thing in some autoimmune cases have shown improvement with our core 4. So core 4 plus the digestive boost would be very important to try for 90 days. And if you don't see any benefits, then don't do it.
Okay, very good, awesome. We're going to go to another one of our favorite affiliates here. Greg Evans asks about what should a person take that has nerve problems that shakes like they have Parkinson's?
Yeah, Parkinson's is, again, Parkinson is almost like analogous from mechanistic point of view, like Alzheimer, but except the different region is the basal ganglia disease, and that dopamine is not produced very sufficient amount because the degeneration of a dopamine neuron. And so again, the best strategy would be if you have already have it, and we have some cases, as you know, Dr. Cote treated it, and the core 4 and digestive enzyme would be the best. And if you are taking for example, dopa therapy, any kind of a therapy that increases, they do L-dopa therapy. And as you know, that the fellow who discovered this therapy, and I did my postdoctoral fellow with him, Dr. Casillas from Brookhaven National Laboratory. That's the place it was discovered. The treatment of which is considered right now gold standard. And but problem is that after 5 years, that therapy becomes worse. The gait and other things become much stiffer and so on, because when you give dopa and you are producing dopamine excessive, because you can't control, cells started producing more dopamine. When they get oxidized, they generate a lot of free radicals. And any leftover L-dopa will be also oxidized and produced. So when you are taking any kind of therapy, this kind of recommendation, nutritional recommendation, will further improve. So instead of lasting only for 5 years, it could last for 10, 15 years. My neighbor who has a Parkinson's disease and taking the regular therapy that a neurologist recommended, plus macro daily, and he is doing very well for the last 10 years.
Wow.
So there is no adverse interaction, and you must take some medication that doctor suggested, but combine these things with that one, and you will enjoy your life better. And you will see that until informed. I'd like to know some of the results through Jeff, because I'd like to know, because some people like Dr. Cote, one patient of Parkinsonism could not get up from his chair. It was so advanced stage. And he said after that certain therapy, after a month, I don't know how long, but then start walking. I mean, that's really, so it is doing, the main thing it is doing is preventing any oxidative stress and inflammation, and then preventing further damage to the nerve cell, and then the nerve cell has a tendency to repair.
It is possible. We saw it back in the beginning, almost 10 years ago, when we were first introduced to these products. We took them to a friend of ours that had a deep brain stimulator implanted.
Yeah.
To control the tremors. He couldn't even feed himself because his shakes were so bad, and so they had this procedure this transplanted into him into his body to control it. And after he spent about 6 months on the product, the deep brain stimulator was turned completely off. He no longer needed it, and in fact, he was doing so well that he became he started working part-time at Lowe's hardware store. You know, to go from somebody who couldn't even feed himself to now working
I
at
mean,
Lowe's.
so this is important to try it, I always say that because we don't have a classical, clinical study on patient and so on, but this is a nutritional issue. The worst thing would be it has no impact, and best thing would be you will enjoy your quality of life.
Yep, fantastic. So, Rob, I can talk to you after this and go through what your question there is with the glucose and the glutamine. Let's quickly, if we can, hear from Ursula. I'm not familiar with her. She has never been on one of our programs before, and that'll be the very last question. So, maybe I'm pronouncing wrong. URSULE. Go ahead. Yeah, go ahead.
Thank you for giving me the opportunity. Thank you, Dr. Prasad. I have two persons. One has an advanced heart failure, and he started with like 2 pills. Now it's to 15 per day. So I don't know what you can advise for that kind of person.
So you're saying advanced heart failure, and what pills were they taking? Was it micro daily, or is it some other medications?
No, so some other macro daily, but he doesn't really believe or trust me. But yeah, I did also give him macro daily. Yeah.
Okay, because we've got videos of heart patients that are doing just amazingly well by just supporting the body from a nutritional standpoint. And so get back with the person who invited you on, and we can share some of these videos with your friend.
The other one has hemorrhoids.
Well, you'll need to state that make that statement again. I didn't catch it. What?
Hemorrhoids. One person is suffering with his stool is only bloody.
Yeah, I'm not
Hemorrhoids.
understanding. Oh, hemorrhoids. Hemorrhoids, Dr. Prasad.
Yeah, again, I don't have an idea. Hemorrhoid. I mean, again, try these things, score 4, if it helps you, because that is again inflammatory reactions, and try for a month or 2, and if it helps you, continue. If it doesn't, you go. So I always suggest that take not only micro daily EMF, but also probiotics is extremely important for those kind of situations, because inflammation is the major issue for hemorrhoid, and so. So I think I would say try core 4 for 2 months, and if it doesn't help you anything, then don't do it.
Yeah. Ursula, who enrolled you? How can we follow back up with your questions after this?
Thank you, sir.
Who enrolled you?
Oh, Dr. Clark.
Dr. Clark.
Clark.
Okay. All right. Okay.
Clark.
So now
It's under Jane.
Yes. Okay.
Okay.
All right. Thank you, Dr. Prasad. Everybody open up your cameras and your microphones, and thank Dr. Prasad for being here with us this evening.
Thank you, Dr.
Thanks so
Prasad.
much.
Thank you, Dr. Prasad.
Thank you, Dr. Prasad.
Dr. Prasad.
Thank you,
Appreciate you
Dr.
guys.
Thank you,
Thank you,
Dr.
Dr.
Prasad.
Prasad.
Great day.
Dr. Prasad. Thank you, Jeff.
Thank you.
Thank you.
Thank you
Jeff.
so much, Dr. Prasad.
Thank
Great
you,
call, Jeff.
Thank you.
All right.
Thanks, Jeff.
Good night, everybody.
Prasad.
Yep.
And
Bye-bye. Good night, everybody. And,
Bye, everybody.
Good night.
Good night.
Thank you
Good night,
so
Jeff.
much.
Have a great one.
Love my
Thank you.
micro daily family.
Love you, Dr.
All
Prasad.
right.
Love y'all.
All
Thanks,
right.
thanks, Dr. Rich and Linda. for
God
being
bless
here.
all of you. Have a great day.
Alrighty.
Good night.
Bye-bye.
Good night, everybody. Yes, and
Bye.
check.
There you go.
All right.
Make sure that you're subscribed to the Engage Global YouTube channel. That's where when this gets this gets posted, that's where it will go.
ahead.
Where's it at? Where?
This is the
Where?
This is the Engage Global YouTube channel.
Are you there, Jeff?
Thank you.
Yes, Rob.
Oh, it doesn't go on Teams there. Engage.
Rob?
Global.
Yeah, in Engage Global YouTube channel, and it's going to have the little EG symbol there. So, yep, look for that, and you can go back over to tonight's call. So,
Will last night's call be on there as well?
last night's call will be on Team Serve, Team Serve's YouTube channel.
How do I?
TEAMSERVE.
Oh, thank you. Thank you.
Team Serve. Yep.
Thank you very much.
My pleasure. And it's great to have all of you here. And wow, are we ever fortunate to have access to Dr. Prasad, world's foremost expert on micronutrition and supplementation. And he's here to assist us in learning this. You understand that his background is an educator. I mean, he is a professor and he taught this to others, and he's so patient with each one of us as we ask these questions and seek this information, this knowledge. So great to have all of you here.